Hello, my name is Tressa Shields, and this is my presentation for Dr. Joe E. Ringdahl. Who is Joe E. Ringdahl? He has been a part of the ABA community for over 25 years. He is currently an associate professor for the Department of Communication Science and Special Education program at the University of Georgia. He received both his PhD and Master's in Psychology from Louisiana State University, and he received his Bachelor's in Psychology from the University of Florida. He has written and co-authored a number of peer-reviewed journals, articles, as well as co-authored a book. He currently serves as an associate editor for the Journal of Applied Behavior Analysts and an editorial board member for research in developmental disabilities and education and treatment of children. I looked at 5 articles written and co-authored by Dr. Ringdahl. They all focus on decreasing behavior. The first journal article, Resurgence, the Unintended Maintenance of Problem Behavior, Education and Treatment of Children, studied problem behaviors returning after extinction due to non-maintenance of problem behavior. It also discusses the variables that affect the maintenance of behaviors after extinction occurs. The article gives several examples of resurgence behavior that had been extinct for a period of time. One of the examples in the study included 4 children with autism. They asked each child to help and assist in various real-life situations. The task of helping became generalized within different environments as they continued to participate in helping others. Although the children enjoyed helping others, they also enjoyed the reinforcement they received. My second journal article, Relations Between Rate of Negative Reinforcement and the Persistence of Task Completion, discusses DRA, or differential reinforcement of alternative behaviors, and how it can be used to address problem behaviors. However, the article does point out that there could be some problems with maintenance of the behavior. There are several studies in the report. The one I found most interesting was the study on 1,517 boys over a period of 9 years. Interestingly, the story points out that boys with aggressive behavior as young children would continue to have problem behaviors as they got older. Aside from using DRA as one of the interventions, they also tried functional-based interventions. The biggest problem they found was that the boys with the most severe behaviors, the negative behaviors, could have been reinforced throughout the 9 years, causing the aggressive behavior to continue. The third journal article combined antecedent variables as motivating operations with functional analysis, studied 2 male participants who were in an inpatient psychology facility, had aggressive and destructive behaviors. One was 17 and the other was 2.5 years old. The results found during the functional analyst aggression was observed when they restricted the objects that both students wanted. However, no aggression occurred during the free play. During the treatment, aggression decreases during the first session of treatment to 0. But as the care provider conducted the same treatment, the aggression had increased. The fourth journal article, Negative Side Effects of Non-Contingent Reinforcement, studied a 13-year-old girl with severe mental retardation with severe aggressive behaviors. When a preferred item was removed from her possession, she became severely aggressive, which resulted in the return of the item to calm her down. The focus was on the treatment of this behavior. The last article, The Effects of Antecedent Variables on Disruptive Behaviors and Accurate Responding in Young Children in Outpatient Settings, was the one outlier that focused on assessment rather than treatment. The study looked at the effects of an antecedent variable on disruptive behavior. In this study, it appeared to be clear that the parents were concerned that their child purposefully did not listen to them. It assessed that when the student is more familiar with the person, i.e., the parents, they tend to act out negatively and be more disruptive and defiant. When parents were present, the negative behaviors, which was considered a negative reinforcement, increased during the outburst and created a problem in completing a task which occurred at a lesser rate. A clear example was when the son showed disruptive behaviors when one-step directives were given a preferred task by one of his parents. In the study, the one-task directions seemed to be more accurate in positive completion of tasks than the two-step or the three-step directives. All journal articles but one study fit the pattern and focused on decreasing severe aggressive behaviors through treatment. The latter, the last one I spoke of, was on the assessment of the behavior. If I had the opportunity to interview Joel Ringdahl, I would ask him 5 questions. My first, what made you decide to go into the field of behavioral psychology with concentration in severe behaviors? What is your greatest strength as a psychologist? With your focus on autistic clients with severe behaviors, how would you counter a client who is hitting, punching, scratching, biting, or spitting on you? What advice would you give a new behaviorist entering the field of psychology? Are there any new behavior treatments for autistic clients with severe defiant disorders or severe aggressive behaviors? And lastly, who was your biggest influence that guided you into the world of psychology? And what impact did they have on your decision to become a behaviorist? Why is Dr. Ringdahl work important? His work continues to impact the ABA community and has helped shape the clinical practices in the area of applied behavior analysis. His research in the treatment of severe aggression and severe problem behavior has assisted in helping discover the correlation among people that have developmental disabilities. And lastly, he continues to impact the field of ABA education through his teaching at the University of Georgia. My references have been provided for you in this last screen. Thank you for watching my presentation of Dr. Joel E. Ringdahl.